Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for preventing, identifying, and treating biceps tendinitis. Tip number 1 is identifying biceps tendinitis. The biceps tendon is right here. This is the biceps muscle, and the tendon is what attaches muscle to bone. Biceps tendinitis is pain, swelling, and inflammation of the biceps tendon. It usually occurs after a lifetime of overhead activity, and usually you'll experience a dull, achy pain in the front of your shoulder that moves down the biceps. So starting here and moving down the biceps. The pain is usually worse at night and with repetitive arm use or overhead activities. So tip number 2 is how to prevent biceps tendinitis. Because biceps tendinitis takes years to cause symptoms, you can prevent biceps tendinitis by avoiding years of doing the same motion with your arms. So examples of sports where you have frequent overhead activity are swimming, the crawl stroke, and tennis. It's great to be active and to do exercises, but it's important to vary the muscles used and not to use the same muscles over and over again for years. This is a great way to prevent, if you avoid repetitive arm motions overhead, it's a great way to prevent biceps tendinitis. Tip number 3 for biceps tendinitis is to see your doctor. Your doctor can confirm the diagnosis of biceps tendinitis as well as exclude other causes of shoulder pain such as rotator cuff tendinopathy or tendinitis, rotator cuff tears, and frozen shoulder. Your doctor will feel your biceps tendon, which is, here's the doctor feeling it with his thumb right there. That's the biceps tendon in the bicipital groove, so right there. And at the same time as with one hand he's touching your biceps tendon, he'll rotate this arm back and forth so that he can feel the biceps tendon move under his finger. If you have pain at that location with this test, then it's possible that you have biceps tendinitis. Another test that can be performed by a physician or physician assistant or nurse practitioner is called the speeds test. With this test, you can see the physician's left hand is stabilizing the shoulder and the right hand is providing resistance as the patient with palm up tries to lift her arm as the arm is kept held straight. Pain at this location also is suggestive of biceps tendinitis. And lastly, some physicians know how to use ultrasound at the bedside to get a picture of the biceps tendon and see if there are any lesions or tears. So we've discussed how to prevent and identify biceps tendinitis and the importance of going to a doctor or physician assistant or nurse practitioner to be diagnosed with this shoulder abnormality because there are other possible causes of shoulder pain. This next tip and the remaining tips are for treatment. Tip number 4 is to rest the shoulder. Keep your arm below your head and avoid the repetitive arm activities that aggravate the pain. You might need to keep off these activities for at least a month to feel improvement. Tip number 5 is to apply ice or a cold gel pack or a bag of frozen vegetables to the affected area where there's pain every 1 to 2 hours. This will help reduce swelling. Tip number 6 is to use NSAIDs, which are non-steroidal anti-inflammatory drugs, for 7 days straight scheduled. So it doesn't even matter if you feel the pain or the pain is getting better or getting worse. You have to take this medication on a schedule. For diclofenac gel, which the brand name is Voltaren, it works directly on your skin. It's topical. You apply 2 grams 4 times a day. Naproxen, or the brand name Aleve, comes in 220 milligram tablets. You take those 1 every 12 hours. You should be careful with these medications if you have high blood pressure or stomach problems like ulcers. So I suggest you speak to your doctor before starting either of these medications, though they are over the counter. Tip number 7 is physical therapy. I recommend physical therapy if you've tried rest, ice, and NSAIDs and you're still having pain. You can start with these home exercises, and if they're not helping you, you can ask your doctor for a referral for a physical therapy appointment. The first exercise here, both these exercises should be done about 5 minutes each every day for about a month. This exercise here is called a pendulum stretch, where you just let your arm hang loosely and let gravity pull your arm down, then move your arm back and forth and side to side and in circles. You can add a small amount of weight to make this a more effective stretch. This is called a wall walk, where you start with your fingers at your shoulder height and you walk your fingers up the wall. Both of these exercises are good for strengthening and maintaining good flexibility and range of motion, but you should not do them if they're causing you pain. Tip number 8 is a steroid injection. A steroid injection is an option if you've tried these other measures, including the exercises, the NSAID, the rest, and the ice, and you're still having pain. The steroids are injected directly into the biceps tendon area and can cause significant reduction in swelling and pain. There is a risk of biceps rupture with this, biceps tendon rupture, so it's important to think carefully before you get this injection done. Tip number 9 is referral to an orthopedic surgeon. I recommend that primary care doctors refer to orthopedic surgeon if you've tried all of these activities, the rest, the ice, the NSAIDs, the physical therapy, the steroid injections, and you're still having pain. I also recommend that if you have a distal biceps tendon rupture. So this is actually not a muscle, but this is, or not flexing a normal muscle. This is the biceps tendon that's curled up because of a break in the tendon. This is called the Popeye sign. If you have a distal biceps tendon rupture, I recommend that you be seen by an orthopedic surgeon. And tip number 10 is to believe in yourself. Biceps tendinitis is very common, and there are ways to prevent as well as treat this very common condition. I presented these tips here, and I hope they're helpful. Thank you very much for listening, and have a great day.